Good afternoon. Today is Saturday, April the 11th, 2020. It's a public holiday, of course, but the CCSA is not on holiday as usual. We have our daily press conference, and I'll be providing the English language summary, daily English language summary for the English language audience, as always. The spokesperson started off with the Prime Minister's remarks and amendments to the curfew regulations as delivered yesterday on Thai TV pool at 1800 hours. Yesterday, the Prime Minister addressed the nation asking for cooperation from the general public to stop the spread of COVID and scale down the Songkran festival celebrations. This was done, of course, with public safety in mind as the utmost concern, health concerns in mind. And he also expressed that even though the circumstances have made the holding of Songkran festival unsuitable, Songkran can still be observed in that the true meaning of Songkran is already in the spirit of the Thai people, that is the respect for elders and caring for each other. The Prime Minister also confirmed that the curfew remains in the same hours, duration 2200 to 0400 hours with no extension of hours as rumored. The third regulation issued under Section 9 of the emergency decree was issued yesterday, and that was about indicating the exemptions for some professionals during the curfew, such as medical personnel, police, transport drivers, the employees of public and private sectors who work night shifts, and the rest. This is an additional announcement for clarity. And please note that people who have to go outside during curfew hours would need to obtain the consent of the local authorities. And of course, more information can be found in the government websites, and the general public can also contact the police authorities for any inquiries. For the general situation for today, the numbers that we have are 45 new confirmed cases, making the total number of confirmed accumulated cases in Thailand to be 2,518. So note that this number of new cases in the past days are under 100, but of course we must remain vigilant. The number of new recoveries that we have is 1,135. For fatalities, we have 2 new fatalities, making the fatalities in Thailand totaling 35. The 2 new deaths, which we have to go through every day as information to make the general audience be aware of the risks involved for everybody. The 2 new deaths recorded, death number 34 is a Thai male aged 46 who has diabetes and close contact with family members who has high fever and underwent multiple examinations. The second death, or the 35th death, is also a Thai male aged 65 who had symptoms like cough, runny nose, fatigue, and was hospitalized in Phayao province, and he had been on a respirator as well. And for the figures, there remain now 9 provinces in the country that is COVID-free. The majority of cases are contracted via close contact, and therefore it is important to always wear masks and maintain distance from each other because everybody is at risk. And most of the infections that we have found are through contact actually at homes and in offices. So for the 144 infected persons which were diagnosed, it was found that out of this 144 infected persons in Thailand, 56% was infected from family contact, 23% from at the workplace or through work coordination, and 18% from engagement in social activities and congregation. As for the data comparative to other countries, Thailand's curve is not as steep as other countries now, so hopefully we hope that the curve will turn downwards. The Ministry of Public Health also has a Medical Intelligence Unit, or MIU, And what they have been doing is to keep an alert on fighting the other diseases, other infections, such as seasonal influenza or lung disease. So they have been correlating the information on COVID with information of infections of seasonal influenza and lung disease vis-a-vis COVID. And in controlling COVID, they hope to, in parallel, control seasonal influenza for this year as well. The curfew issue hours, as mentioned, remain the same. The announcement for the amendment yesterday was only for designating certain exemptions, as I've mentioned, for those people who require going outside during the curfew period. So therefore, we repeat once and again for the public to please comply and respect the curfew times, and of course the measures announced by each individual province as well. The next issue is on the Thai national repatriation, which we report to you on a daily basis. For today, we have incoming flights from Russia at 09:45 hours, which has already landed, and from Japan as well. The total number of Thais repatriated for these two flights today is 35. And of course, as mentioned always, the arrival procedures and health screening process is strictly enforced. 100% state quarantine for both flights and all other incoming flights in the future. The spokesperson also touched upon the issue of distribution of surgical and N95 masks, and on the part of the Ministry of Public Health, their supply and sending of surgical masks to hospitals and medical personnel. We have the number for that, which is over 1,900,000, which is separated into 1.7 million surgical and 200,000 N95 masks. These have already been received by both public and private hospitals around the country, as informed earlier, and more are already on their way. However, the distribution of N95 masks still continues to needs the continuation of a close monitoring to truly reflect the needs of certain hospitals whose situations require these surgical masks. And we thank all who have given support to the medical personnel via donation of medical supplies, and we will make sure that the supplies are received and will be put into good use. The other issue, which I had summarized a bit yesterday, the spokesperson mentioned about the visa extension announcement. He reiterated this in Thai for business owners and those who employ foreign nationals in Thailand, as well as those who work with foreign nationals in Thailand, and for the general public. Of course, the Interior Ministry announced yesterday the extension of visas for foreign nationals, applying to those who normally reside in Thailand but are currently abroad. They can come back within a year. For those who have to report to immigration every 90 days, that is exempted. The visa extension is automatic until the 30th of April. And of course, there is also a scheme for holders of border passes. So therefore, Thai employers, especially of those foreign nationals, should be aware of this visa extension in its detail, which can be found in the website of the Immigration Office. The next issue which I would like to touch upon is, in addition to what the spokesperson mentioned, is about the international cooperation that we have. So on the 9th of April, the 10 ASEAN foreign ministers met at the 25th ASEAN Coordinating Council meeting, which is ministerial level, via video conference. And they reaffirmed ASEAN's solidarity to step up efforts to strengthen cooperation and to mitigate the disruptions from COVID. They discussed cooperation on information sharing, best practices for public health emergency, for informing one another of measures and changes of policies that could affect other nationals and members of ASEAN, and of course for the smooth, coordinated cooperation in terms of logistics, and for the supply chain, transportation of essential good and medical supplies during the pandemic. Also highlighted during this meeting was the effective public communication between and among ASEAN member countries for timely, accurate, and transparency. They also endorsed 13 recommendations made, which includes a proposal from Thailand to establish the ASEAN COVID-19 Response Fund, which aims to provide ASEAN member states with funds to purchase test kits, PPEs, medical supplies, as well as cooperation on medicines and vaccines. The ministers also discussed the preparation for a meeting that will take place this Tuesday, April the 14th, via video conference. This is a leaders level meeting, the special ASEAN summit, and the special ASEAN +3 summit on COVID. This, of course, reflects the cooperation going on within the region and between Thailand and the international community. At the same time, I think I won't be wrong in reflecting the sentiment of the Thai people as well. We can see this on social media as well, that the Thai people also offer their moral support to our neighboring countries, to our ASEAN friends, our ASEAN friends and family, as well as to people in other regions all around the world affected by COVID, be it the friends in the Americas, in Europe, in Africa, and in the Middle East. And of course, there is this motto which is One World, One Health. It's a One World, One Health concept as recognized by the World Health Organization and many other countries. And this is truly reflective of our resolve for One World, One Health to better enhance the outcome of public health at an international level. On Songkran, as mentioned earlier, the festivities canceled, and we encourage everyone to follow the government's guidelines. The religious ceremonies, religious leaders have also been informed of this. And of course, as preventative measures, as mentioned yesterday, the Bangkok Metropolitan Administration has come out with a directive to ban sales of alcoholic beverages, as with other provinces around the country. Finally, I'd just like to provide once again general advice to the general public, to the English language audience viewing from Thailand or from the broadcasts from around the world on social media as well, that at this juncture, of course, the risk is for relevant to everybody, to all age groups. All age groups can be susceptible to disease contraction. So please take extra care. Please take extra precaution with regards to your health, and remember that those infected by the disease can potentially infect members of the family. I mentioned earlier that of the sample persons infected that we diagnosed, 56%, the majority, have had family contact, were infected by family contact. So potentially this infection can be within and among your family, but hopefully not. So therefore, it is necessary to observe social and physical distancing when staying at home. This is the summary of the press conference that we have today for the English language audience. Thank you very much. Good afternoon. Sawadee krap.